Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with atherosclerosis and heart attacks. Atherosclerosis is a long word, what you call a medical jargon, but it has to do with the blockage, the narrowing of the vessels with plaque, that is various substances, especially fatty cholesterol, now narrowing the vessels, the arteries, because the blood is transferred to all parts of the body through the heart by going through the arteries. So the arteries serve the brain, the limbs, the heart, all, just every part of your body, every cell receive the blood through the artery, going to the capillaries and then supplying the cells. And when these vessels, the arteries, are narrowed, it creates a kind of serious problem for the heart. And that is one of what I want to really expose to us more, especially because one of the special people I consider very special told me that the one he remembered most about what I have spoken about or done video on is the art on heart matter. So I want to now use the commonest, the atherosclerosis and heart attack, how it comes to be. So how do we prevent this really getting to heart attack is exactly what I want to expose today, and how you can use the laboratory to help you in effectively preventing heart attack. So let us go into the slide section. But like I used to say, if you like what I am talking about, press the like button, subscribe, and be assured that more quality products will come your way. The objective: to create the necessary awareness of the association of atherosclerosis with heart attack and how it could be slowed down or corrected before it happens. The introduction. According to Toby Yama, in 2008 research, atherosclerosis is a chronic systemic inflammatory and metabolic disease and pathologic process characterized by the accumulation of cholesterol and calcium plaque within the arterial wall. The term athero means porridge, and sclerosis means scarring, which is how atherosclerosis was first described on autopsy. On the other hand, heart attack is a blood circulation problem caused by blockage of the artery that will result in serious pains in the chest, and without oxygen supply to any cell or organ, they ends in death. Because blood is supplied through the arteries to all organs of the body, it goes without much saying that atherosclerosis can manifest in any anatomic location, the vascular bed, causing coronary artery disease. That is when the blood vessel supplying the heart itself is blocked. Also known as ischemic heart disease. Once there is a blockage, there is no oxygen. Then cerebrovascular, that is the one supplying the brain, the vessels, all the vessels, the arteries, is disease. And peripheral artery disease, all the periphery organs, the peripheral organs. Atherosclerotic plaque may cause chronic ischemia, which obviously means that the blood will not supply oxygen, shortage of oxygen, and chest pain, and the heart attack. The acute ischemia is usually caused by thrombus formation. What brings about thrombus formation is the platelets. Once there is a blockage, the body coagulatory system will really form thrombus, and once the thrombus should break, it could also cause serious heart attack. Let us look at some figures of the prevalence. An estimated 197 million people in the world were living with coronary artery disease in 2019. And these are the findings of this worker. Why 101 million were stroke survivors? That speaks a lot, because after the cardiac the heart attack, you see that you have a stroke. While peripheral artery disease associated mortality is comparably low, it still represents a significant burden, with 113 million cases worldwide and 8.5 million cases in the United States of America. These findings speak volumes of the problem of a heart attack that could be prevented. I believe that any disease that has stages, one can easily monitor it and prevent it escalating. The stages of atherosclerosis can be considered as atheroma stages. The early stage is when the fat starts building up. The accumulation of the lipid, low-density lipid protein, lipoprotein, cholesterol, the triglyceride, and calcium piling up, forming in certain arterial location, that is in the arteries. So, and then resulting in the little inflammatory markers that you see. That was a finding of that is the first stage. The second stage is the atheroma fibroatheroma. This is the progressive stage of the plaque formation, when the plaque is formed, characterized by the migration of smooth muscle cells into the intimate, attracted by signals from foam cells. The low-density lipoprotein particles and macrophages progressively accumulate into a lipid core, narrowing more the vessels, while the smooth muscle cells produce extracellular matrix protein that comprise the fibrous cap. And that's another finding of the same worker and his co-workers. So that gradually occlude the vessel, but not totally. So you can see that in the picture that will come. Third stage is the advancing atheroma. The final stage of atheroma progression is characterized by a large necrotic core and low smooth muscle cells density, very low, because it is almost covering, because in the beginning, the inner area of the vessel, the artery, is smooth muscles mainly. But as the fats now build up and the plaque builds up, it becomes very small, with a corresponding thin fibrous cap. A vulnerable plaque prone to rupture and thrombosis is another dangerous where the platelet gathers. Atherosclerotic plaque typically progress to the advancing atheroma stage at age 55 years to 65 years. That's the finding of the same author that I had earlier reported. Yeah, this shows a picture of the blood vessel, the artery itself. If you look at it, the red part is more or less where the blood passes. From the right hand side, you can see the thinning. It's as if the red side is wide, and then the fat, the plaque, is very narrow in the beginning. But as it progresses, you can see the plaque build up. That is the fats, the cholesterol, the triglyceride, the blood, the calcium, and other substances building up and occluding the blood vessel. So this explains the atherosclerosis stages very well. Yeah, we may now be interested in how do we correct this problem early enough. It involves the use of medication such as aspirin beta blockers and cholesterol-lowering drugs. That is even when it's becoming gradually increasing in stage, and especially at that age of 55 and 65 and above, when the BP is already being shown. Then there could also be, in the early stage, the removal of the peripheral blocked plaque, the plaque blocking the arteries in the periphery through the arteric
atherectomy. We must also know that smoking damages the artery. So if you are a smoker, you better stop, especially if you are also into high diets, fatty diets, and regular exercises improve blood flow, lowers blood pressure, maintain healthy weight, and eat healthy food. These are the corrective measures that we can personally use to overcome. Yes, the laboratory is very, very useful, especially at the early stages, not when the problem is not very obvious. The signs and symptoms are obvious, and then you can do imaging and the other tests. So it is advisable to always calculate the body mass index BMI and weight measurement as a preliminary screening test by you, the person that wants to do laboratory test. The blood test will be done in the lab, which involves the lipid profile test, cholesterol level estimation, triglyceride level, and blood sugar level estimation. Other cardiac biomarker tests include creatinine kinase, BNP, the LDH, not N, troponin, and myoglobin. The troponin and myoglobin are combined together, especially when you want to confirm whether there is an heart attack, because myoglobin increases within 2 to 3 hours after an heart attack and stays almost a whole day, and by the next day, it has come back to normal. So troponin is very useful, specific for cardiac biomarker test. Other imaging tests that are helpful are the ECG, EKG, echocardiogram, exercise stress test, nuclear test. Yes, we have come to the stage of conclusion where there is great relief. The heart attack from this exposure, because the concentration is more on the heart attack that would usually come if you just eat anyhow and you don't care, which will result in that BMI, large waist, and what have you. But heart attack from this exposure is a gradual process from the second decade of one's life, and it becomes more common and obvious or chronic as we get to 55 years and above. If we moderate our BMI, reduce stress by checking often our cardiac biomarkers, we shall surely be able to prevent the early onset, especially if it is not familiar. That's when we are talking of being genetic. And I am sure with all this, if you find it very useful, you want to watch more of my videos, all on health matters. My effort is towards having a wealthy environment, living among wealthy people, because health is wealth.